CHAFSA USMLE style question on acute cholangitis. A 65-year-old woman with a history of gallstones presents to the emergency department with fever, jaundice, and right upper quadrant abdominal pain. She also reports confusion and has a blood pressure of 90/60 mmHg with a heart rate of 110 BPM. Laboratory results reveal total bilirubin 5.2 mg per normal 0.1 mg per dens, alkaline phosphatase ALP 450 U-well normal 44 to 147 U for la mildly elevated, WBC 15,000 pm normal 4,500 and 11,000 mm. An ultrasound shows dilated intrahepatic and extrahepatic bile ducts. Which of the following is the most likely cause of this patient's condition? A. Gallbladder wall inflammation due to cystic duct obstruction. B. Biliary tree obstruction leading to stasis and bacterial overgrowth. C. Pancreatic duct obstruction due to gallstone impaction. Autoimmune destruction of intrahepatic bile ducts. E. Chronic bile stasis leading to cholesterol supersaturation and stone formation. Answer B. Biliary tree obstruction leading to stasis and bacterial overgrowth. Explanation. This patient presents with Charcot's triad, fever, jaundice, and right upper quadrant pain, and signs of sepsis, hypotension, altered mental status, which together form Reynolds pentad, highly suggestive of acute cholangitis. Acute cholangitis is caused by biliary obstruction, e.g. gallstones, strictures, malignancy, leading to stasis and bacterial overgrowth, typically with Enterobacteriaceae, E. coli, Klebsiella, Enterococcus. Key diagnostic findings: fever, jaundice or acute pain, Charcot's triad, hypotension, altered mental status, Reynolds pentad. In severe cases, elevated bilirubin and ALP, indicating biliary obstruction, leukocytosis, sign of infection, dilated bile ducts on imaging, ultrasound, or MRCP. Option A, gallbladder wall inflammation due to cystic duct obstruction, describes acute cholecystitis, which presents with RUQ pain, fever, and Murphy's sign, but without jaundice or bile duct dilation. Option C, pancreatic duct obstruction due to gallstone impaction, describes gallstone pancreatitis, which presents with elevated lipase and amylase rather than direct hyperbilirubinemia. Option D, autoimmune destruction of intrahepatic bile ducts, describes primary biliary cholangitis, PBC, a chronic condition with anti-mitochondrial antibodies. Option E, chronic bile stasis leading to cholesterol supersaturation and stone formation, describes gallstone formation, which is a risk factor, but does not directly explain the acute infection seen in this patient. Thus, the correct answer is B, biliary tree obstruction leading to stasis and bacterial overgrowth.